Hi everybody, Dr. Sam Gaston here with North Texas Sport and Spine, continuing our February video series on common baseball injuries. First video we focused on rotator cuff strains. In this video we're going to follow up with another soft tissue injury, and that is going to be the hamstring strain. So starting with the hamstring, that's a series of 3 muscles on the posterior side of the upper leg. That's going to be the biceps femoris, the semitendinosus, and the semimembranosus, and those are 3 muscles that are very important in baseball, both in throwing and in batting. So they are going to be part of the power generation of the lower extremity, both in hitting and throwing. In hitting, they help with some hip extension along with the glutes to generate some power. They're also very important in the power transfer from the lower extremity into the core and the pelvis in terms of generating power through the swing. And they help with some deceleration and stability on the back end once you're following through with that swing. With throwing, they perform a lot of similar actions as they do in hitting. They provide stability on that lead leg to give you some balance, and then they're also going to help again with the power transfer through the core and some of that rotational force, and then deceleration again, which is very important in both the throwing phase and pitching or hitting, because if you don't have that controlled deceleration, you're going to either fall out of the batter's box or fly off the mound as you follow through with your pitch. So hamstring's really important for both hitting and throwing. When you're dealing with the hamstring strain, depending on how severe it is, it's going to determine both the recovery time with it and some of the symptoms that you're feeling. You can sometimes, when it happens, feel a pop. There can be bruising, swelling, depending on how severe the tear in that muscle is, whether it's individual muscle fibers involved or more of the muscles themselves because it's a higher grade tear. Treatment-wise, we're looking at a lot of similar treatments as we would have done with the rotator cuff injury. So you're looking at rest, just to give it some time to heal a little bit. We want to be mobilizing it as much as we can, keep that muscle healing in an active way instead of just putting scar tissue down there. We need that muscle tissue to be pliable and movable still, and not just that static scar tissue. Dry needling is important for this as well because it's going to stimulate that healing process. Cupping, scraping, any of the soft tissue modalities like that are going to be useful. And then obviously we have to do strengthening once the muscle has recovered so you can return to play as efficiently and powerfully as possible. Similar to the rotator cuff strain, grade 1 is going to put you out potentially a couple days to several weeks, whereas grade 3 again can end up being surgery, especially when you have those serious strains where you can actually get some avulsion of the muscle off of the bone. That's going to require surgery. That could put you out up to a year. So that is hamstring strains in relation to baseball athletes. Next week we'll cover a new injury for the baseball player.